Greetings. It is an honor to be in Johor Bahru, Malaysia.
Correct.
Which, if you leave the island of Singapore, when you drive across the bridge and enter Malaysia, this is the first city on the other side of the bridge in Malaysia.
Correct.
And you told me it would take probably 6 hours to drive to Kuala Lumpur? 6 hours or
3 or 4?
Oh, just 3 to 4 hours. And it would take 24 hours to drive all the way to the next country of Bangkok, Thailand. Or you said what, 8?
Borders
The border,
10 hours or 12 hours?
10 hours to the Bangkok, to Thailand.
Borders,
Yeah. So I want you three to introduce yourself. Tell everyone your name and tell us about yourself.
Good. My name is Dr. Stephen Phun. I'm practicing in this clinic in Johor Bahru for the past 26 years. I'm not that young anymore. And
I'm 1 year older than that.
can't tell you how old we are. And I've been having a small clinic of 3 chairs, and it's been a very busy clinic, and it's very fruitful clinics. All right, okay. So may I introduce to you Dr. Saul. She just joined us about 2 years back, and she got a lot of things to tell you.
Okay, my name is Dr. Woon Ling, and then I stay in Singapore. So every day I will cross the causeway to work in Johor Bahru, and then I've been a GP for about 8 years. I do everything in my practice except implant, and I think that's all.
So you live in Singapore and work in Malaysia?
Yeah.
So wouldn't that take a lot of time to cross the bridge every day? Why don't you live here?
Oh, because actually my family all settled down in Singapore, and then it only takes me about 40 minutes to come from Singapore to this clinic, if there is no jam. Yeah, but there's certain times like during December where there's a school holiday, and then the jam is quite bad lah. Usually per trip is 3 hours lah.
And just asking, in Malaysia, what percent of the dentists are girls versus boys? I mean, right here we have 2 boys, 1 girl. Are the girls a third, a half? What percent of the dentists are girls?
What percent? I think
More
should be more. Girls should be
I
more.
would say at least about 65 to 35 now.
65% girls?
Yeah.
And is that common in all of Southeast Asia? More girls than boys?
I think that's a trend worldwide. If I'm not wrong, actually.
So
Yeah.
So 2/3 of the dentists are girls in Malaysia. What would it be for Laos, Cambodia, Thailand, Vietnam, Indonesia? Because I know you've lectured in all those countries.
I think in developed countries like Thailand and Indonesia, I think the situation is about the same, or slightly better, about 55-45. But in country like Cambodia, Vietnam, maybe in Burma, probably still male-dominated professions. You're talking about dentistry. One of the reasons is that there are more ladies in our dentistry, probably because sometimes the guy says that I want to do something else like engineering and others, so they're all diverted to the other side. But the girls, they'll say dentistry is a good thing because it can be a part-time job when you finish.
You know how I can tell that you're old? because you said Burma instead of Miramar.
Yeah.
So are you gonna say Peking instead of Beijing?
That is still a Peking duck. It's not a Beijing duck. Okay, so that's for sure. All right, but it's I think that's what's happening now in the world, because if you go to any developed countries or developing countries, if you go to the university, you'll see that. I'm sorry to say, I think the girls rules.
Yeah.
If I'm not wrong.
I would rather go to a girl. So,
yeah. I'm Dr. Ron Ng. I just joined this practice not long ago, like maybe a few months ago. And this is my 3rd year of practice. Yeah.
And this your what?
Third year of practice.
3rd year?
Yeah.
So you guys have 3 operatories and 3 dentists, which is very, very Asian. In America, usually 1 dentist will work 2 chairs or more. But in Asia, you usually see 1 dentist per each room. And so you guys probably do your own cleanings too, right?
Oh, you mean cleaning the dental chairs and everything?
No, cleaning the patient's teeth instead of a hygienist.
Oh yes, actually what happened is that we are not allowed for hygienists, not because that you don't want them, it's because by law we haven't reached the stage that we allowed hygienists to practice dentistry. Okay, so probably the law is in the process of changing, but if I'm not wrong, in about next 5 years, you'll see the category under the dental practice, there'll be a hygienist and there'll be dental nurses and therapists coming in. We are a bit about 15 years behind the States, but we're catching up. One of the reasons is because probably the dental costs has gone up and the population is getting older, and you have to think about cause and effect.
And what is
the
your
older
definition of
generations.
older?
Life starts at 60.
Life starts at 60?
Yes, okay, fine. My friend, the time when you feel, the moment you say, this is too old for me, that's one pin down, and, just like playing bowling, one pin down at one time, and then slowly you'll notice that, as you admit it, you're gone.
I think one area Asia is very far ahead of the United States is I look at your hours. You guys are open Tuesday to Saturday 9 to 5, Sunday 9 to 1, and then you're closed Monday. And obviously, consumers, customers, patients, it's easier to go to the dentist on a weekend, and you're closed Monday, and you work 44 hours a week. In the United States, the dentists seem to work 32 hours a week, and they always close weekends. You'll almost never find a dentist open on Friday, Saturday, or Sunday. So I have to applaud you that I would say the average Asian works 12 to 16 hours a week more than a lazy American. And I can say that because I'm an American.
Yeah, American.
But no, they always say to me, I need more money. I got to pay off my bills. I need to do anything. And the last thing they'll ever think about is, why don't you just work 6 days a week? I mean, that's the last thing that will ever cross their mind. That's the last thing I want to hear. But so you guys all do orthodontics, right? And you've been teaching for PS Ortho,
Progressive Orthodontics.
Progressive Orthodontics, which is a teaches really solid fundamental orthodontics all around the world. And that was started out of California, right?
Yep. Yes.
What was Don McGann? Don McGann out of California. So tell us about your journey with POS Ortho, and you've taught that in Beijing or Peking, Bangkok, Medan, Indonesia, Singapore, Kuala Lumpur. Talk about your journey with POS Ortho.
Well, put it this way: when I first graduated, it took me about 2 years to get bored with general practice. So I was looking for something to upgrade myself, and by chance there's a orthodontic course for private practitioners, GPs, that's available in Singapore. So I signed myself in, and that's the progressive orthodontic course. And when they first started, they conduct the course by using videos. If you still can remember, the cassettes that we have. Okay, they conduct by videos, and I'm that old, but it still passed through the thing, because the one that they want you to learn is basically the knowledge. So you just have to look at it, learn from it, and then try it, solve the problem along the ways, and slowly you'll get used to it. So I've been practicing since 1992 until the year 2007, and Don was in Singapore, I think, at that time, and he says, how long have you been practicing? I says, well, 20 years. And he says, well, you look like a decent chap. Would you like to teach orthodontics? I says, in my mind, I was thinking, that's a good way to retire. So I say, okay, yes. So he dragged me in. So Don is a very generous person, okay? When he says he wants to train you, he really train you up. He pay for everything. And then the only thing that you need to do for him is to help him to teach the other GPs about orthodontics. But there's a catch. He didn't tell you for how long. So you owe him not a debt of money, but a debt of gratitude. So I'm still paying his debt, okay? So it's not bad, because working for people like Don, he treats you well. The student treats you well. You travel the world, just like you, doing your job and travel the world. But the only drawback is that you're not in your clinic all the time. And as you can see, some patient is, saying that, no, where have you been? You're supposed to treat me. I says, no, I'm sorry. I have to teach the other doctors to teach you. That's it.
Talk about the difference between fixed wire brackets and braces like POS Orthodontics versus removable clear aligners like Invisalign, because Invisalign is a significant lab bill, and that significantly changes the price of ortho. I mean, in Malaysia do you do more in removable clear aligner Invisalign, or do you do more fixed band and bracket hardwire ortho?
I think most of the orthodontic treatment in Malaysia is still brackets and bands, but I think Invisalign and the clear aligners are coming in slowly. Cost is one thing, but the demand of the patient is another one. Okay, but the one that worries us the most is that probably because if a GP is trying to learn orthodontics, and if you go for a simple course and you don't have a basic knowledge about how the teeth move, how the bone affected the movement of the teeth and how you set it up, sometimes you don't know how to troubleshoot. So if you use Invisalign, you are basically depends on the person that diagnosed it for you. And the complication is that he's not in the country that you're working in. So legally, it's
what country are they in?
Most of the time, I think they send it to the States to get it diagnosed and send back for the aligners.
Yeah. Now, see, I thought if you take an impression, it usually goes to Mexico and the model work's done there, and then it's diagnosed in Costa Rica. That's what I thought. But that's what I heard. But is it United States?
Yeah, actually, what happened is that, if I'm not wrong, they send it to a centralized place. But the person that diagnosed it must be somebody that have used a aligner before, they're experienced with it. They did their diagnosis, and then when they write it up, they just pass it back to the center to manufacture the aligner, if I'm not wrong.
But when I we have Dental Town, but we also have Ortho Town. So Dental Town is about 210,000 dentists from around the world. Ortho Town is about 5,000 orthodontists. You have to be an orthodontist in our town. But it seems like their big complaint with short-term ortho is what you're saying. The person didn't get a complete diagnosis and treatment plan. That with ortho, it's all in the diagnosing and treatment planning.
Correct.
And you were telling me that you thought POS Ortho really did a great job of learning the fundamentals of complete orthodontics.
Yeah, I would say that is the most important thing about POS, is because they actually basically teach you from zero onwards. What they did is that they build up the foundation first, and they really make sure that your foundation is good before you say, no, I want to move that teeth.
So in your practice, what % is orthodontics?
Personally, I think half my patients are in orthodontics.
And what about you two?
Actually, I'm quite new to this field lah. Probably about so far the ongoing case is about probably 10 or slightly more than that lah. I'm still learning stage lah. That's why I'm only randomly pick some quite straightforward case lah. The more complicated one will still refer to Dr. Steven.
This is a mentoring process that you have to do.
Learn ortho, or
Yeah, I'm learning ortho together with her. Yeah, so we start together with it. So still on the way of learning.
And do you like it?
Not too bad, but I prefer endodontics.
You prefer endodontics. That is so neat. That's what I love the most about dentistry is there's so much you can never learn. You couldn't even learn half of it if you tried.
Yep.
And if you don't like something like we were talking about earlier, like pediatric dentistry, you don't care for pediatric dentistry. That's what you said, right? But you love endodontics.
Yes.
And you find so many dentists who can't stand endodontics. And they like other things. That's what's so neat about dentistry. It's never a dull day, and if you don't like something, you don't have to do it, because there's so much other stuff you can do. Are either of you, all three of you, doing implants, placing implants?
I used to do a lot of implants, Megagen. The first one that I put in is a Nobel straight. That was really long ago, and nowadays I'll put it more of the mini implants probably because after a while of conventional implants, you just want to try out some minis. But what I discovered lately is that it has its good, but sometimes the certain cases conventional implant is much more superior. So sometimes you have to wait it out, because I don't think there's a perfect system in the world. So it depends on what your patients present with, because if that case is suitable for certain implants, use that one. Sometimes it's a demand, sometimes it's the case dictate that you have to use that, and sometimes it's because your own preference. But one thing for sure is that implants has been going on for quite some time now. Now the problem is this: everybody claim that they have one that suits everybody. I don't think so. Just like orthodontics, you can't have one that suits everyone, because certain cases like what McGann teach is straight wires. Sometimes the individual prescription, which is the IP system that we are using, is good, but certain cases is Damon. Certain cases I can see that some of the old practitioners using backs and still come up with good results. I think it depends on what works in your hand. Orthodontics, endodontics, the system that you use, pro tapers, reciprocals, same thing. Depends on what you're used to it and whether you can master the system that you're using or not. So choose one, be good at it, and then only then you try the other one, because you got one to fall back to.
So is your favorite endodontics? And what do you charge for a molar root canal in Malaysia?
Charge amount for a molar, maybe 1,002 ringgit.
That's about
1,200 ringgit.
Yeah, 1,200 ringgit.
And what would that be in US dollars? 400 US.
300. No, 3 to 400.
3 to 400 US.
3 to 400 US.
And how much do you charge for braces, orthodontics?
Oh, I charge about
2,000.
8 to 10,000.
8 to 10,000 ringgit.
3,000. I think it's about 2,500 to 3,500. 2,500 to 3,500 US dollars.
2,500 to
2,500 to 3,500. Depends
2,500.
on what you use. Yeah.
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 And do you being close, just you cross the bridge, you're in Singapore.
Yep.
So do you get a lot of Singapore people coming to Malaysia because it would be less expensive than in Singapore?
That is a myth, but there are some truth in the myth. What happened is that they do come over to seek treatment because of cost. But what I notice is that if they do come over because of cost, they will try to bargain with you, and they will what we call clinic hopping to find the cheapest cost. That sort of patients, sometimes you spend about 5 minutes to educate to them, says, what you want is cost. Yes, but get the right treatment done. Don't cut corners on that. And then when they say, yep, I want this treatment, then you tell them, says, for good quality work, comes with good price. Simple as that. Everything is like that. Yes, it's cheaper. Even pound for pound, the same treatment, same quality, it might be cheaper in Malaysia. Okay, but
How much cheaper?
about
3 times?
no, not 3 times. I would say about 30% cheaper.
30%.
Yeah, 30% cheaper. But the problem is that the hassle is that you have to cross the causeway. You need a passport to cross over. You need a transport to come over here. After you finish, you have to go back. Now the thing is this: certain treatments like implants, that is not a one-stop thing. You have to come back all the time. So is orthodontics.
But
You
she
see
comes,
every month.
she comes every day.
Or she come and earn money every day. It's okay. You come for treatment once in a while, then it's different. You know what I mean? Yeah. So she's okay because you see, one of the reasons that she's working here, yes, is because of money. But the other one is that I run a mentorship program in this clinic. So they are my 11 or 12 students that I coach all the ways. I've been coaching some students since 97, 98. So they take turns coming in, and then we share knowledge. And by the time in 2 years' time, when they learn whatever I want to teach them, they graduate. So what happens is that once they move forward, there's somebody else who come in to replace them, because at that time I don't have 3 dental chairs, I only have 2, so I can train 1 at a time. Yes, Yoda and what's his name again? If you watch Star Trek or Star Wars, yeah, you know what I mean. 1 at a time. That's how you make sure that they learn all the things correctly.
Was it Star Trek or Star Wars?
Star Wars, Yoda, and someone else. I can't remember what's the name.
Well, I hope I don't remind you of Yoda.
No, we are 1 year apart. That's it.
Now you guys are also you're looking into mini implants. Tell us about that part of your journey.
Oh, that one I bumped into it by accident because one of my patients says, I need to get my dentures fixed and it's loosed, and I says, okay, fine, I'll try to figure out how to do mini implants for you. So the first few mini implants that I got from MDI, which is 3M, yeah, it worked pretty well, but people are very adventurous. They try to fix a crown on it, and it failed miserably. And I says, okay, fine, don't do it. But back in 2009, I was invited back in Singapore. Now, one of my job is to be a mentorship backup for some of my students in Singapore. But since I went in there once a day, I'm quite free. So they tossed me some cases that, failed mini implants, asked me to look into it and asked me why it failed and how it failed and see if you can find a way to solve the problem. So I was looking at multiple cases of failed implants, mini implants, conventional implant, and what I tried to figure out is that why it failed. Okay, but what I feel is that for conventional implants, there are a lot of smarter people than me that try to figure it out, and I'm sure that they got the solution right. But for mini implants, it's a abandoned child. Nobody is interested in it. Once the mini implant failed, they say, yep, its system is no good. But when I look into it, there's not much wrong with the system, but it's the way that you put in. So it's the operator's issues that you have to look at. It has its role. Okay, it has its role. It's just that when are you going to use it and how are you going to use it to maximize your success rate? And that is important. That is still an ongoing project for me.
What system are you using now?
I learned it from Torchic, which is a MDL intralock system. It's from the States, but
That's www.intra-lock.com.
correct. He's good enough to share his experience with us and share his pain with us too, because no matter who you
The
are.
system you mentioned, 3M, was the MDI system that was invented by Dr. Max Sandex. Right?
Yeah, I think that the two pioneers in mini implants is Sandex and Shetkins. So what happened is that along the way, Dr. Sandex decided to sell half the company to 3M, and they maintained the name by MDI. But Todd actually come up by himself. He says, I'm going to develop it.
Oh yeah, that's fine. If you got to go to work, that's fine.
Yeah.
Don't.
Okay. Yep.
Yeah.
Okay.
Thank you for joining us in the very beginning.
So what happened is that I think there is a split between them. So Sandex retired. So there's not much movement after being sold to 3M. But what Shetkin did is that he looked into it. He says, he's a younger of the two partners. So he says, I still got a career to do. So if I'm not wrong, he got some investor in to support his company, and he developed it after that. So come up with some attachment and everything. Not perfect, but we're refining it slowly. Because if I'm not wrong, the path that we are taking now for mini implant is the same path that we took for conventional implant back in 70s, where we have quite a few failures and we try to figure out how it failed so that we can correct them up to a certain stage that, when you have about 95% success rate, then you say, yes, we are done.
And when they fail, what do you think is going on when they do fail?
Well, one of the thing that they keep telling you is that, you put the mini implant in until the ball head stick out from the gums. That's where the failure is, because you don't know where the bone is. So if you don't have enough bone, the bone engagement, of course it fails. If you got a thicker gum, do something about it. When you put in your mini implant, make sure that it's stable and put it all the thread inside the bone. Don't leave it outside. Simple as that.
So you got out of school in 1990, and this is 2016, so 26 years. My question to you is, we hear different things. We hear things that in Asia, that today children drink a lot more Coke or Pepsi or soda. So I want to ask you, going back to 1990, 26 years ago to today, do children in Malaysia have more cavities, the same number of cavities, or less cavities than when you started a quarter of a century ago?
I would say the DMFT counts for children around this region has actually dropped compared to maybe about 25 years ago. 25 years ago, I mean, you look at children, they still have bad teeth. But nowadays, DMFT, I think it's 3. Yeah, 3 is low. 3 is low compared to about maybe about 10, 12, 25 years ago.
So do you think that what's more important is the dental IQ going up of more dentists brushing and flossing? That's more important than the dietary sugar going up?
I think the public education part is very important because dental hygiene behaviors have changed, and one of the things that they did is that it's actually teaching the pregnant women how to brush properly, and that makes sense too because women rules at home. So I haven't seen a dad teaching the kids how to brush their teeth. I don't know about you, but most of the teaching done at home is done by mom. So if you teach the mom the proper technique, chances are they'll get it right for the next generation.
Do you see much baby bottle tooth decay in Malaysia?
Once in a while, not that much anymore. Not that much anymore.
So the mothers know.
Yeah.
So the mothers have been educated more today than they were 25 years ago.
One other thing too, you can't get baby bottle caries with breast milk. So they have been encouraging breastfeeding in this part of the world for quite some time now. So I presume that helps too in a way. Yeah.
And do you think water fluoridation has had an effect on how common is water fluoridation in Malaysia? And do you think that's had an effect on bringing down decay?
I think we got it in it depends on where you are. I think 1960 something in most of the major towns they will have water fluoridations, and this minor town probably up to the 80s, and then we get the whole country fluoridated. Now, how important it is, I think that is one of the major factors that the DMFT gone down actually. Yeah.
Was water fluoridation?
Yes, because they don't prescribe any more fluoride pellets, tablets or anything for pregnant ladies anymore. So you get it from the water. Simple as that.
So is water fluoridation common in Southeast Asia? I mean, is it common in Vietnam, Laos, Cambodia, Thailand?
I think it is because at this moment I haven't heard anything. Didn't hear any activities for the anti-fluoridations campaign in Southeast Asia. I don't think they have any campaign at all. But if you look at the scientific facts, I think it still works. That is the best way to prevent decay. Is water fluoridations. I mean, of course, you get it right. We do have molting cases, like fluorosis and others. That is because probably at one time, the supervisor gets slack, and then this sort of thing do happens. It's human error rather than the mistake of the chemicals.
So I'm going to ask you a controversial question. Which lasts longer on a the most common tooth to have a cavity is a first molar. The most common tooth to be pulled is a first molar.
Correct.
The most common tooth to be replaced by an implant is a first molar. The most common tooth to be replaced with a bridge is a first molar. If somebody came in here and had a MOD filling, what do you think would last longer, an amalgam or a composite?
I'll let the young one start first.
He's gonna defer. It's controversial when he won't even answer the question. He hands it to you to get you.
This is a very tricky question. I believe amalgam lasts very long. It's like 20 years. But the current composite, which is the bulk fill for the posterior teeth, I believe it lasts very long also from the research. Yeah, depends how you use it. Definitely, if you want to use a composite, definitely you need a very good isolations to make it success. That's the only problem with the composites. And the strength of this thing, I believe, for the current composite is strong enough to withstand the stance. Yep.
So for the 9,000 dentists in Malaysia, what % of fillings on molars, just molars, obviously the front teeth would be more composite, but on molars, what % do you think done today in 2016 are amalgam versus composite?
Okay, depends which sector you in. If let's say you're saying the public sector, the government sectors, right? For the posterior, I believe they're not using amalgam also. They're using GIC.
GIC, glass ionomer.
Yes, glass ionomer.
Made by who?
Made by who? GC? Maybe GC.
GC?
Yeah, mostly because of the time issues. They need to do a lot of patients in a day. So they in rush, they're using a glass ionomer. Then if
They would not use amalgam, and they
depends
would.
on the practice. I did
But-
use
but public-
amalgam. I did use amalgam in the government, and slowly I changed it to composites. Yeah, I'm still using two, but I prefer using a composite nowadays.
And why do you prefer a composite over a glass ionomer or an amalgam?
Okay, first of all, is let's say we talk about glass ionomer. It doesn't stay long.
It doesn't last long.
Yeah, it doesn't last long. Even because it's easy to wear off. Okay, one of the reasons. Then and the contact point is not that good. Then because your foot stuck, all these things and carries. Then amalgam and composite is giving a good result. I wouldn't say one is better or one is not that good. It's good results. Just certain time in amalgams it cause crack expansions, or we hardly to hold the amalgam. Then I would choose composites for
Now-
aesthetic reasons maybe.
Now, does this office right here offer both, or just
We offer both.
you offer both? Is one lower cost, one higher cost? Or are they the same cost?
Definitely higher cost.
So, how much would an amalgam? How much would an MOD amalgam cost on a lower first molar? How much would an MOD composite cost on a lower first molar?
I think about 2.5 times more expensive if you
The
do a
composite is
composites.
2.5 times more.
And one thing about amalgam.
And how much would that be?
Oh, composites is about $250 to 300 ringgit and above. Amalgam probably about 100 to 150.
And what would 150 ringgit be in US?
Oh, it's about 40 to 50.
$30, $40.
Yeah.
So you
Actually,
offer-
one of
so-
the question is about amalgam and composite is that depend on who you ask. Because if you ask a practitioner that is my age, okay, you say, you want me to do composite, it's over my dead body. Because you need to relearn the thing that they've been taught in university and redo it again. But if you ask a youngsters like him, then he'll say, over my young body, because I'm not going to go back to your old age amalgam. So sometimes there's a generation gap in our training too. Because you and I train up in amalgam, and if you want to do composites, you have to retrain again. And I don't know about you, but in my point of view, it's slightly different, and it takes longer time and takes more effort. And if you have an MOD in the 6, I'll ask you to do a crown.
When I was in school, we filled the teeth with dinosaur bones. So tell me another thing we're seeing all around the world. I mean, it doesn't matter if you're in Brazil or India or the United States. In the last 10 years, Malaysia's gone from 4 dental schools to 18 dental schools. What do you think about? I mean, what is it like to have? I mean, 4 to 8 to 12 to 16. I mean, that's an explosion in dental schools. And what are your thoughts on that? Is that a good thing, a bad thing? How is that going to change dentistry in Malaysia?
Put it this way, if I tell you the truth, we have a law, it's called the Internal Security Act. I might end up in jail.
Seriously?
Oh yes, of course. I mean, these sort of things are our official secrets. But the truth is this, if you're talking about a population of 24 million back in 2006, and we have only about 5,000 dentists, what's the patient to what's the doctor to population ratio is way too high.
Okay, so
let's
let's do the math on that. So you're saying in 2006.
Yep, you
there
got
were
5,000 dentists and
20
24 million patients.
Okay, let's do that.
That
24
is the
million.
need of dentistry.
24 million divided by 5,000 would have given you a ratio of a dentist for every 4,800. And the United States is a dentist for every 1,800.
Yep, that's bad.
So that was 2006.
2006,
So now what is it in 2016?
you're talking about
So now you have about 30 million people, right?
30 millions,
30 million people.
about 8,000 dentists.
And is it 8,000 or 9,000?
The thing changed quite a lot because
Okay, so if it's
every year we have
8,000,
about
if it's
1,000 plus coming
8,000,
out.
it's 3,750.
Yep.
So it's coming down.
Oh yes, but the thing is this. But the thing is that the momentum is too high because you're producing about 1,000 and plus dentists a year. So the
How many
attrition
dentists a
rate-
year?
About 1,000 plus.
1,000 plus?
Yeah, that includes those that have been trained overseas and coming back. So we're going to have a little bit of issue in terms of whether there's enough patient to do around, because the figure that you're talking about is 3,700 to 1 is the need of dentistry. But if you and I would know, if you do what we call the human resource planning, we are looking at the demand. Now, question is this: how many percent of the populations demands dental services at any given time? I would say about 40.
Let's go back to the Malaysian diet. You lived in Australia for you
10
went to
years.
dental school
Yep.
in where did you go to dental school at Queensland?
Yep, in
So that's
Queensland University
Brisbane?
in Brisbane. Yeah.
So you went to Brisbane, Queensland. Who eats more sugar, an Australian or a Malaysian?
I would say both because
Both?
depends on where your sugar come from. We got sweeter drinks, okay, but we don't eat a lot of sweet desserts or anything. It's not popular in Malaysia to have sweet dessert, but sweet drinks, yes, probably that's the evil
And
of
what
them
are
all because
what are sweet drinks like fruit drinks?
yeah, sodas, canned foods,
Sodas.
canned drinks and everything. So now the problem is that sweet drinks, you can see the effects not just in teeth. You can see the obesity coming in. Okay? And in Australia, I think
What-
at one time they
is
have
he- is he- are you
that
talking
is
about me?
always- that's
Are you
always-
talking about
that's not
me or are you
obesity.
talking about the
But
the
in Australia
Australians?
it's different because they don't consume a lot of canned drinks or anything. But the evil is that they love sweet desserts, cakes, everything.
In Australia.
Yeah, but if you ask me, is it the sugar in the diet that counts? Yeah, part of it. But I think the other thing is the nature of the food. Sticky foods stays longer in the mouth, and that's where you get the decay.
You know what I was surprised to see who eats the most sweets, cakes and cookies in my life. I would have never guessed, but you know who it was in my?
I think the Europeans.
I think it's India.
Oh yes,
Oh my
Oh,
God!
yes.
I don't think anybody eats more cakes and cookies and sweets than in India.
yeah.
I mean, every 100% of the time you went to a dentist's house, they greeted you with a tray of cakes and cookies and everything had sprinkled sugar on it. I mean, my God, that was an awesome trip. Just eating all those.
That is what we call courtesy, because they serve you the best food that they can have, and then you just worry about your diet later on. That's how it goes. But one thing true about this part of the world is that the sugar is more readily available, more refined, more sticky. We don't have a lot of Mars bars or Snickers, but we're getting there slowly. So I think the food is there.
I want to ask you.
The fluoride itself makes the difference.
I want to ask you another question. How many dentists in Malaysia are not from Malaysia? Do many expatriates come here? I mean, do dentists come here from other countries? Is it like if I wanted to be a dentist in Malaysia, how hard would it be for me to get a license to practice in Malaysia?
Kamu cakap bahasa Malaysia?
What?
See what I mean? He can't speak the language. That's the major problem.
So the test would be in Malaysian.
Not really, because you see, one of the things to practice good dentistry is your communication with your patients. If they can't tell you where the pain is, how are you going to treat them? And that is the catch.
So would the government not give me a license because they would say I wouldn't be able to talk to the patients?
Oh, it depends on how qualified you are. Because if you work as a GP, you're meeting the public all the time, I think language is very important. But if you are in a status now at the moment as a consultant, chances are the local language might not be that important, because English is the one that you teach the dentist.
Well, I know in Singapore it's pretty easy to get a license because the first 2 years you have to work under supervision.
Right.
And then if you work under supervision after 2 years, this guy says, "Oh yeah, he's a good dentist," then you get your license. But is it not like that in Malaysia? You can't work under supervision. You need to speak Malay.
One of the criteria is you need to speak Malay. Second, you might need to be a PR, residents, or married someone is residents. Then you need to work for government for 2 years. So you need the language to.
So then that's an advantage that you're not having a lot of supply of dentists coming from other places in the world like they are in Singapore
No.
and Australia.
No?
I mean, a big part of the increase in the number of dentists in Australia has been because it's so easy. Like 1,000 dentists in Australia migrated there from another country. And it was very easy for them, for expatriates expats to come to Australia and practice dentistry?
Actually, there's a lot of dentists in Australia. It's just that they practice 4 days a week.
Are you saying Australians are lazy like Americans?
No, they have a very sharp tax man, which is true because in my course of teaching orthodontics, we have fellow teachers from Australia and from New Zealand and from States, and the first thing that they talk about, after why don't you work in your own clinic? You earn more. You say, what's the point? Because my tax bracket is one of the highest, so that's why I say no. I myself come out and enjoy life, and that's true in Australia because we have a tax bracket of about 47%. When you're hitting about 300,000, which is for a dentist is nothing. What's the point of working harder? You might as well employ someone, give them a chance to work, let them earn a living, and while you have your monies, life is short. Go and enjoy what nature can give you. Light up the barbecue, go for sailings, probably drop a few lines for fishing. This is life. Yeah, that's why you choose. In Malaysia, it's different.
So, anything else that you're passionate about? Anything else you want to talk about? Anything you're passionate about, like to talk about in dentistry? Anything got you excited in dentistry? What's got you excited in dentistry?
To me, is the challenge. Maybe something that other people cannot do, I would like to do. Challenges, maybe, yeah. Try to be the best or one of the best. Maybe.
Now you're doing braces on your girlfriend.
Yes.
Isn't that kind of dangerous? What if the braces don't turn out? You might lose your girlfriend. Do you think that's dangerous to work on your girlfriend?
So I have to do the best for her. I have no choice.
Is that a lot of pressure?
Not really. I got my mentor.
Yes, it is. You know why? Because anything go wrong, I got to step in. But one thing for sure is that what's our challenge? What's next for us in dentistry? What's our passions? Look, you and I, we are not old, for sure, but
You said we aren't?
we aren't old. Life starts at 60. Okay, so now the most important thing is that. With the experience that we gain, okay, what are we supposed to do with it? Because if you and I are not careful, we might bring it 6 feet down. So my passion is that before we go, make sure that we write down whatever we learned and pass it to youngsters like this. Because in a few years' time, you and I will be opening our mouth, and they are the one that give us the treatment. So we better train them well. And I'm not joking about it because the population is getting older and older, the more challenge is it. So we better do something about it.
One of the things I've been saying for at least 10 years is I've been in so many dental schools in so many different continents, and I actually think the next generation of dentists are better than our generation. They are. I mean, I feel so amazingly awesome handing off the dental baton to the next generation because they just seem bright-eyed, bushy-tailed, giggling, laughing, fun, wanting to learn everything, not knowing where to start. I mean, they just seem eager to learn, and they just seem I think they're. But that's well put. We have to train them because someday you and I will need you to fix our own teeth. And
in the meantime, join them to have some fun.
So, any other parting words? Any other thing you passionate you want to talk about, or any
Put it this way, if you come and interview me in about a year's time, I'll tell you something else.
Okay.
Life evolve.
Okay. Well, thank you so much for taking me and my boys to lunch, opening up your dental office, spending an hour with us today. I just think you guys are fantastic, and thank you so much for letting us come in and give us some of your time.
It's my pleasure.